Welcome to another episode from the Veterinary Research Channel. Today, we're diving into a fascinating area of veterinary internal medicine, exploring the intricate relationship between sex hormones and thyroid function in female German Shepherd dogs. This is based on a detailed study conducted by Proestrus et al. Have you ever considered how many factors can influence a simple blood test? In veterinary medicine, assessing thyroid function is far from straightforward. Age, breed, medications, and underlying health conditions all play a role. But what about the estrous cycle in female dogs? Could the hormonal fluctuations that come with it affect thyroid function? That's exactly what this research team set out to investigate. The researchers focused on German Shepherd dogs. They hypothesized that the different stages of the estrous cycle could indeed influence thyroid function. To test this, they conducted a longitudinal, observational study following 17 female German Shepherds through their complete estrous cycles. To accurately track the estrous cycle, the team used vaginal cytology, a method of examining cells from the vaginal lining, and measured progesterone levels. These methods allowed them to pinpoint each stage of the cycle: Anestrus, Proestrus, Estrus, and Diestrus. During each stage, blood samples were collected. These samples were a treasure trove of information, allowing the researchers to analyze the concentrations of various hormones: total thyroxine, free thyroxine, total triiodothyronine, free triiodothyronine, canine thyroid stimulating hormone, progesterone, and 17-beta-estradiol. They also kept an eye on triglyceride and cholesterol levels, providing a more complete picture of the dog's metabolic status. The dog's overall health was carefully monitored with comprehensive hematological and biochemical evaluations performed at the beginning and end of the study. Let's dive a little deeper into how the researchers determined the different stages of the estrous cycle. This is crucial because the hormonal milieu changes dramatically from one stage to the next. For vaginal smear interpretation, the research team looked for the following. During Anestrus, they noted a predominance of basal and parabasal cells, which are round in shape and have a high nucleus-to-cytoplasm ratio. Leukocytes and bacteria were rare, and there was abundant amorphous extracellular material. In Proestrus, the key feature was the predominance of intermediate, polygonal, and nucleated superficial cells. They also observed abundant erythrocytes and moderate numbers of leukocytes and bacteria. Estrus was characterized by a predominance of anucleate superficial cells or cells with a low nucleus-to-cytoplasm ratio. Erythrocytes, leukocytes, and bacteria were scarce. Finally, in Diestrus, the researchers saw a predominance of intermediate, basal, and parabasal cells, occasional foam cells, moderate leukocytes and bacteria, and abundant amorphous extracellular materials were observed. So, what did the results reveal? One of the key findings was that age significantly impacted thyroid hormone concentrations. Total thyroxine, free thyroxine, and free triiodothyronine levels were all negatively correlated with age. In other words, as the dogs got older, these hormone concentrations tended to decrease. But the most striking result was the variation in total thyroxine levels across the different estrus stages. The researchers found significantly higher concentrations of total thyroxine during estrus and diestrus compared to Proestrus and Anestrus. In fact, total thyroxine concentration was significantly lower during Proestrus than in all other phases. Delving deeper into the hormonal relationships, the study revealed a positive correlation between total thyroxine and progesterone concentrations. As progesterone levels rose, so did total thyroxine levels. Conversely, there was a negative correlation between total thyroxine and 17-beta-estradiol concentrations. When 17-beta-estradiol levels increased, total thyroxine levels tended to decrease. Canine thyroid stimulating hormone concentrations were positively correlated with 17-beta-estradiol concentrations. However, there were no significant differences in thyroid hormone and canine thyroid stimulating hormone concentrations between diestrus during pregnancy and pseudopregnancy. To ensure the results were reliable, the researchers meticulously controlled for factors that could influence thyroid function. All dogs were German Shepherds, aged 6 years or less, with no history of endocrine, reproductive, metabolic, or immune-mediated diseases. They had normal hematology and serum biochemistry results. The dogs were fed a commercial maintenance diet and lived in the same district in northeastern Italy, minimizing environmental variations. Interestingly, the team also found that cholesterol was negatively correlated with 17-beta-estradiol and was significantly higher during diestrus. This observation aligns with previous studies that have reported higher cholesterol concentrations in spayed female dogs. It's important to remember that breed can play a significant role in thyroid hormone and canine thyroid-stimulating hormone concentrations. For example, collies, Samoyeds, and Casehaunts tend to have higher canine thyroid-stimulating hormone concentrations compared to golden retrievers. Certain breeds, like greyhounds and whippets, often have lower free and total thyroxine concentrations. The researchers also drew parallels with human studies. Research has indicated that progestin treatment can increase free thyroxine levels in humans. This may be because progesterone stimulates an increase in total thyroxine secretion without affecting thyroxine-binding globulin concentrations, potentially leading to an increase in the free hormone fraction. On the other hand, high-dose 17-beta-estradiol treatment has been shown to decrease thyroid secretory activity in rat models. As with any study, there were limitations to consider. One limitation was the use of a non-dialytic method for measuring free thyroxine. Additionally, there wasn't published validation data for dogs for all the methods applied. However, the researchers did perform internal validation, which demonstrated good accuracy for all methods. So, what's the take-home message? The stage of the estrous cycle can indeed influence serum concentrations of total thyroxine in female dogs. While these changes may not always be clinically significant, they should be taken into account when investigating altered thyroid function. The researchers suggest that investigations during Anestrus may involve fewer variables, potentially leading to a more accurate diagnosis. This study sheds light on the complex interplay between sex hormones and thyroid function in female dogs. By understanding these relationships, veterinarians can make more informed decisions when diagnosing and treating thyroid conditions. It appears that total thyroxine concentrations are higher in estrus and diestrus compared to Proestrus and Anestrus. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.